The next presentation by Dr. David Budakena.
Good morning, all. I'll be talking about a new laser, 695 nanometer laser. This is an interim study report. So I have no disclosures. So keloids and hypertrophic scar pose a challenging problem in dermatology. We had limited success with traditional modalities, and we see that hypertrophic scar can regress and it is limited to the trauma, whereas keloids can progress beyond the areas of trauma. These are the current treatment strategies in relation to steroids, 5FU, then surgical manipulation, cryotherapy, radiotherapy, and then lasers. And most of these lasers target water as chromophore, that is the ablative and non-ablative lasers. The NDAC, PDL target vascular components. Both target fibroblasts and collagen indirectly, and it can cause PIH. So we did a study with 18 patients of skin type 4 and 5. We have 4 cases each of hypertrophic scar and 5 cases each of keloidal scar. 9 patients underwent a combination of 675 nanometer with triamcinolone, whereas 9 received 675 nanometer laser alone. We did 3 sessions at 3-week intervals. It's an interim study, so we had completed the whole thing. And the patients were monitored for their treatment response over 2 months post-procedure. A subject satisfaction questionnaire, a Likert scale was done. And these are the inclusion criteria. One is all new cases of keloids and hypertrophic scar, and excluded all patients who had underwent some treatment in the last 6 months for that, and then those who are unwilling for the study or follow-up. And these are the results. The advantage was most of the patients with ILS and laser showed a faster response, whereas the laser alone had a slower response. But the recurrence was very less in the post 2 months follow-up. And these were the responses I got with the patient. This is 3 sessions of non-ablative laser. And this was completed in November 2023, and there was no recurrence. Instead of 2 months, we actually followed up till date, and there were no recurrences. This is another patient. That is the parameters used of 5 watts, 100 milliseconds, 200 micron gap between the spots, and 1 to 2 passes followed by intralesional triamcinolone. There's another patient. The immediate softening. Most of these keloids are very hard, and injecting with an insulin syringe is very difficult. So when you do the laser, the skin becomes really soft, and then you can inject easily. So if you want to combine it with intralesional, it has a specific advantage. This is on the other side of the same patient. This is completely flat lesion, but the pigmentation is still there. And this is over the chest. And I did some patients on the burn scar and traumatic scar, and these are the results. This is only 1 session. The lesions are completely flattened. The pH is still there. This is a burn scar. Around the nose, you can see the scar has really improved. These are the side effects. One is erythema that lasts for a few days. Minimal pain. There are micro burns and mostly post-inflammatory hypopigmentation, which is seen to fill up after some time. So that is not a big issue. And coming to the device, you have an optical window of 650 to 950 nanometer. Below 650, it is absorbed by hemoglobin, and above 950, it is absorbed by water. This is the optical window, and the light goes through this window, and it acts on the collagen and the melanin. So it directly acts on the collagen and selectively targets the dermal collagen, and it resulting in fiber shrinkage. And it can also act on the melanin, producing an improvement in the pigmentation. So reduced downtime, reduced risk of PIH. Now what you see is you have microzones of thermal damage, which is 1 millimeter in diameter, with a penetration depth of 700 nanometer. And there is denaturation of the collagen fibers and neocollagenesis. So you get more new collagen, and that improves the scar. And these are the indications where you can use this versatile device: acne scar, traumatic scar, keloidal hypertrophic scar, melasma, chronoaging, lip rejuvenation, stretch marks, and androgenetic alopecia. So these are the areas where this has been used. Contraindication basically is the same as any other lasers, but you have to avoid tattoos, and in patients with hypersensitivity to red and near infrared light, you have to avoid that. To conclude, this is a novel 675 nanometer laser. It's a versatile device, very less side effects and downtime. There are multitude of indications, and we chose this device for keloid and hypertrophic scars since the main target is collagen in these conditions. The main advantage of combining laser with ILS was reduction in the recurrence and softening of the scar, which helps in your easy injection. And you need a longer or larger study to really see the efficacy. Thank you. Thank you for your patient listening.